Before the rise of exosome therapy, one treatment dominated the world of skin rejuvenation: platelet-rich plasma, or PRP. It was the go-to for medical spas and aesthetic clinics. And even today, many still use it alongside newer exosome-based products. PRP works by using your own blood. A small sample is drawn, then spun in a centrifuge to separate the plasma, the part rich in growth factors that help your skin repair and regenerate. That plasma is then applied topically or sometimes injected into the skin or scalp to promote healing and collagen production. But there's a catch. This process takes time, requires special handling, and for some people, the idea of using their own blood can be uncomfortable or even off-putting. And here's something most people don't realize: PRP's effectiveness tends to drop as we age. That's because the platelets in older adults contain fewer growth factors, meaning the rejuvenation potential is limited by your own biology. Now, this is where exosome therapy comes in. Unlike PRP, exosome-based treatments don't require blood draws or needles. These tiny cell-derived messengers come from reliable, lab-prepared sources, often derived from stem cells, and they carry potent regenerative signals to your skin. The best part? Their effectiveness doesn't depend on your age. Whether you're in your 20s or your 60s, exosomes can deliver consistent, powerful results, often stronger than what your own plasma can achieve. So while PRP opened the door to regenerative skincare, exosomes are taking it to the next level, offering a smarter, simpler, and more effective way to help your skin look and feel renewed.